When it comes to prostate cancer, deciding which treatment option is the best for your care can be difficult. Well, Dr. B of Prostate Cancer Institute of Arizona is talking about a treatment that can lower the amount of hormonal treatment that we are needed, which is very important. Doc, we know when people go through prostate cancer and they go through the treatments and stuff, it's very important to them to know that there is life afterwards. And just last week, you said that a report came out about hormone treatment to get a man back to performing right, as we can say.
Yes. Well, men with the most aggressive kind of prostate cancer that we call high-risk prostate cancer, which is in relation to their risk of their cancer spreading outside their prostate, these men typically require 2 to 3 years of hormone treatments in addition to the radiation. And these hormone treatments can be really tough on you.
Yeah.
What happens is that these medicines block the testosterone supply to stop feeding the cancer and can help the radiation work better. But then, unfortunately, with no testosterone, it puts you into this menopausal state, and so men can be really symptomatic. You have hot flashes, loss of libido, impotence, tired, muscle loss. So it's often that men are most complaining about the hormones than actually the radiation.
Yeah.
And so now with this new study, it showed that when you get what we the low dose rate brachytherapy, the prostate seed implant, these men only require 6 months of hormones rather than 2 to 3 years.
Wow.
So that's a big deal. So they can get back to their normal life a lot quicker when they get the prostate seed implant in addition to their standard radiation.
Yeah, and that's what you do. And actually, the treatment that you're doing was around a long time ago. It kind of like went away. And then you saw the need to bring it more to light because of this reason right here, is that men were getting treatment that you said was pretty much having to be on hormones for 2 years. And now with the treatment you do, it brings it back sooner.
Exactly. Like I said, my whole goal is to revive this treatment that went away for the wrong reasons and really has a lot of positive aspects to it that other treatments don't have. And that's the reason why it's so important that these men have this option that wasn't really available until now.
Yeah, we know that this is Breast Cancer Awareness Month, but also we know that next month is Men's Health Awareness Month, and this is a really good time to be talking about this and talking with your doctors about, of course, if you are going to be getting prostate cancer, what your options are, because you said there's mild prostate cancer that can be taken care of through your treatment, and there's other, of course, treatments to be done, and so that's why it's good to sit down and talk, especially right now if you are getting ready for treatment.
Yeah, awareness is key because when you identify the cancer earlier, it's a lot easier. So men that have prostate cancer found in much earlier stages, they don't even need any hormone treatments, and so that's a big plus because when you have advanced prostate cancer and let it go, now you need 2 to 3 years of hormone treatments, and it can't be easy. It's not easy. Oh, obviously now you only need 6 months if they get brachytherapy, but still, even 6 months is not fun if you can be found earlier and don't need any.
Right. Okay. So with this hormone treatment, I mean, is it another shot? What is it? What
Yeah,
takes
they're typically
place?
shots delivered every 3 to 6 months, and like I said, it sort of sucks the manhood out of you, and these men are really miserable.
Yeah.
And sometimes it can take a while to actually recover. Even though you may have only been on it for 6 months, it could actually take 6 months to a year to get back to your normal testosterone levels.
And that's why it's great to get in there and talk now and get this, but it's great that the treatment that you do is helping men recover a little bit sooner, and of course with hormone therapy gets them back to an active life that they want to have and stuff, which is so great.
Yeah.
So, well, Doctor, we thank always coming and talking, especially being one of our Live Well partners too, is so important. So we thank you again. Let people know where they can find out more about you and everything we're talking about here.
Yeah.
So, of course, PCIA.
Thank you.
So thanks, Doc. All right, thanks for coming in.